Hi friends, I'm Annie, your friendly health coach. Welcome to my page. In today's video, I'm going to talk to you about urinary tract infection. You can follow my health and well-being on all social media platforms. Now let's get to the topic for today. In case you don't know what a urinary tract infection is, let me explain. A urinary tract infection, or what we call UTI, is a problem that occurs when germs called bacteria get into the urinary tract and cause an infection. Your urinary tract is the system that produces and carries urine out of your body. This includes your bladder and kidneys and the tubes that connect them. Most urinary tract infections are bladder infections. A bladder infection is usually not serious if it is treated immediately. If you don't treat a bladder infection, it can spread to your kidneys. A kidney infection is serious and can cause permanent damage. Most urinary tract infections are easily treated with antibiotics. Let us now look at the symptoms of a urinary tract infection. When you have a UTI, the lining of the bladder and urethra becomes red and irritated, just like your throat does when you have a cold. The irritation can cause pain in the lower abdomen, pelvic area, and even the lower back, and usually result in you having to urinate more frequently. Burning or pain when urinating is the most common symptoms. You may even feel a strong urge to urinate but only pass a few drops. This is because the bladder is so irritated that you feel the need to urinate even if there is not much urine in your bladder. You may lose control and leak urine. You may also notice that your urine smells bad and is cloudy. Your urine will appear red, light pink, or color colored, or signs of blood in your urine. Children with urinary tract infections may also have a high temperature. Your child feels hotter than usual when you touch their neck, their back, or even their tummy. The child will appear generally unwell. Babies and young children may be irritable and not even feed or eat properly, or they will also wet the bed or wet themselves. Kidney infections often cause fevers and upper back pain, usually on one side or the other. Kidney infections may also cause nausea and vomiting. These infections need to be treated at once because a kidney infection can spread into the bloodstream and cause a life-threatening health issue. If you're wondering what causes a urinary tract infections, numerous bacteria live in the area around the vagina and rectum and also on your skin. The bacteria can enter the urine via the urethra and migrate into the bladder. They can even reach the kidneys, but no matter how far they travel, bacteria in the urinary tract can cause problems. Women are more likely to get a urinary tract infection than men because the urethra is shorter in women than in men. So the bacteria have a shorter distance to travel to the bladder. If you have diabetes or you are pregnant, the likelihood of infection is higher. You are more likely to get a bladder infection if you have a problem that blocks the flow of urine from your bladder. Examples include kidney stones, an enlarged prostate, or a structural problem in the urinary tract. Women who repeatedly suffer from urinary tract infection may also have inherited genes that make them more susceptible to these infections. Let me say this. As I mentioned earlier, female anatomy contributes to the fact that women are more likely to contract a UTI. A woman's urethra is shorter than a man's, making it easier for bacteria to enter the bladder. A woman's urethral opening is also close to a source of bacteria from the anus and vagina. Bacteria can enter the urethral opening through sexual activity. Bacteria in the bladder does not always mean that there is an infection. Like the bowel, the bladder has bacteria and other microorganisms that help keep it healthy and functioning properly. Some forms of birth control can also increase the risk of urinary tract infections. Diaphragms can slow down the flow of urine, allowing bacteria to multiply. Unlubricated condoms or spermicidal condoms can cause irritation, which encourages the growth of bacteria. The following factors can also encourage the growth of bacteria. For example, not drinking enough fluids. You deliberately hold back urine for a longer period of time. Spinal cord injuries or other nerves damage that makes the bladder difficult to empty regularly and completely. Conditions or situations that block the flow of urine, such as a tumor or sexual intercourse. Age, for example, children and the elderly are more likely to get urinary tract infections. For example, menopause like causes change in bacteria inside the vagina. And we also have like potty training. When you have an indwelling urinary catheter, you are more likely to develop a UTI in your bladder or kidneys. We also have multiple sclerosis. Let me emphasize on this. Urinary tract infections are quite real in young men and young people with male anatomy. They are more common in men over 50 because they may have an enlarged prostate gland. If enlarged, the prostate or gland near the bottom of the bladder can block urine from the bladder. This means the bladder doesn't empty completely, increasing the chance that bacteria will grow and cause an infection. Other risk factors for men include practicing anal intercourse, being uncircumcised, partial blockage of the urethra, a catheter tube inserted to relieve a partial blockage of the urethra. So my question is, can urinary tract infections be prevented? Let me give you these few tips that may help reduce your chances of getting urinary tract infections. Number one, practice good hygiene. Practicing good hygiene is one of the best ways to help prevent urinary tract infections. This is especially important if you have a vagina because your urethra is much shorter and it's easier for E. coli to move from your rectum back into your body. Always wipe from front to back after a bowel movement to avoid this. During your menstrual cycle, it's also a good idea to regularly change your period products, including pads and tampons. You should also avoid using any deodorant on your vagina, or let me just say hard product on your vagina. Tips 2, drink plenty of fluids. Drinking extra fluids, especially water, each day can help flush out bacteria from your urinary tract. Another tip is change your peeing habit. Peeing can play a big role in getting rid of bacteria from your body. Your pee is a waste product, and each time you empty your bladder, you help remove that waste from your body. Peeing frequently can reduce your risk of developing an infection, especially if you get urinary tract infections a lot. You should also try to pee right before and right after having sex. Sex can introduce bacteria to your urethra, and peeing before and after sex helps flush it out. If you can't pee, wash the area with warm water. Other one is change your birth control. Some people have an increased risk of developing urinary tract infection if they use a diaphragm for birth control. Talk to a healthcare provider about other birth control options. My next one is change clothing. Tight fitting clothing can create a moist environment which promotes bacterial growth. You can try loose fitting clothing and cotton underwear to prevent moisture from accumulating around your urethra. The next one is medications. If you are postmenopausal, a healthcare provider may suggest a vaginal cream that contains estrogen. These creams may help reduce your risk of developing a urinary tract infection by changing the pH of your vagina. Talk to a healthcare provider if you are postmenopausal and get a lot of urinary tract infections. Over the counter supplements, including cranberry extract and probiotics, may also help prevent urinary tract infections. Talk to a healthcare provider before you start taking any supplement. Please consult your healthcare provider with any questions or concerns you may have about urinary tract infections. Always remember to consult your doctor first about your health issues, and don't forget to take good care of yourself. If you have any questions or comments, please leave them below. If you enjoyed this video, please remember to follow my page and share it with your friends. Thank you, and hey, bye.